you, Deanne, to the next speaker.
Hello everyone, I'm coming from China. My name is David Liang. I'm 35 and this summer I have the privilege to work in Dr. Rago's lab. And here I presented this study named Role of Androgens in Ischemia Reperfusion Mediated Acute Kidney Injury. Okay. Ischemic reperfusion, acute kidney injury, IR, AKI for short, occurs in 15 to 20% of individuals aged between 20 to 64 years. And studies found that men are at greater risk for renal failure and mortality due to AKI than women. And similar studies also found that animal models of IR and AKI also showed sex differences in renal injury. So this study posed two questions. First, why are men, including male animals, more susceptible to AKI than women? And the second question is, what is the role of androgens in mediating AKI in men? And the hypothesis is, IR-induced AKI causes reduction in plasma testosterone. And testosterone supplementations after AKI protect males from kidney injury. So to go into this study, we used male spray dolly rags that were subjected to 40 minutes ischemia, and then we used testosterone propionate 20 milligrams per kilogram or ethanol vehicle given through IV 3 hours after reperfusion. Then urine samples were collected the next 24 hours, and then some of the rags received aromatase inhibitor and anastrozole 0.15 milligrams per kilogram per day or water vehicle beginning 2 days before and continuing throughout the study. Then rags were euthanized at 24 hours and urine sample and serum and kidney tissue were harvested. And kidney injury can be measured by the following: plasma creatinine and kidney injury molecule 1 and proteinuria. And then this study indicates, just like this diagram shows here, renal ischemia reperfusion increases plasma creatinine noticeably, but testosterone supplements attenuate the increase more than 20%. Then it also indicates in this diagram that IR increases kidney injury molecule 1 in urine, and then testosterone again decreases the level of KIM1 dramatically. And finally, IR increases proteinuria, and again testosterone supplementation attenuates the level of proteinuria. And then plasma testosterone is reduced 24 hours after IR injury, and as this diagram shows here, is not affected by testosterone supplements. Before we go into further detail, I would like to show you this diagram, which is about sex hormone synthesis, and this study focuses on testosterone. And testosterone, as we know, that it can be easily aromatized into estradiol. So we use this inhibitor, anastrozole, to prevent the conversion of testosterone into estradiol. So we can study the effect of testosterone. And this prevention, as this diagram indicates here, it shows that this prevention of the conversion reduces the plasma creatinine after IR injury. Like here. And then again, it also reduces KIM-1 in the urine after an IR injury, more than 50%. And finally, proteinuria also dramatically reduced after IR injury with the prevention of testosterone into estradiol. And in this diagram, it shows that plasma testosterone tended to be increased with anastrozole, but as the diagram shows here, the result is not significant. And in summary, this study indicates that IR-AKI reduces plasma testosterone by 24 hours after reperfusion. And then supplementation with testosterone 3 hours after reperfusion attenuate the severity of kidney injury at 24 hours. And although data are not shown here, castration promotes, as the study indicates, renal injury, and testosterone supplements protect against the severity of IR and AKI. And finally, the study indicates that the mechanism for testosterone protection is not mediated by the conversion into estradiol. Thereby, we make a conclusion that IR-induced AKI causes a reduction in plasma testosterone that contributes to kidney injury, and treatments of patients with testosterone supplements who have AKI to protect them from severe renal injuries. And here I would like to express my thanks to Dr. Rector and Dr. Junko, and the other members in my lab. And without whose effort, this presentation would not have been possible. And also, I'd like to thank you as my audience with your kind attention. And thank you very much.
Next up, Lucas Thomas.